Good afternoon, everyone. Srinase, am I audible?
Yes.
And PPT also visible, sister?
Yes.
Yeah. Good afternoon. A warm welcome to this virtual national conference on impact of COVID-19 on women, that is especially rural women. I welcome all the participants outside Maristella College and from Maristella College to this program, and I also welcome today our eminent resource person, Professor I. Satya Sundaram garu to this gathering. Before we start our program, let us start this by invoking the blessings of Almighty. Now I call upon our students, Sister Sarita and Sister Asha from First BA, to render prayer song for us.
हे प्रभु दिल के मंदिर में है तो सागर के लहरों में कोयल के गानों में जहाँ देखो तू ही तू हे प्रभु दिल के मंदिर में है तो सागर के लहरों में कोयल के गानों में जहाँ देखो तू ही तू हे प्रभु दिल के मंदिर में है तो सागर के लहरों में कोयल के गानों में जहाँ देखो तू ही तू बागों में खिले फूल सब तुझको ही बंदिया राधे ऊंचे गगन के पंछी भी महिमाएं तेरी गाए बागों में खिले फूल सब तुझको ही बंदिया राधे ऊंचे गगन के पंछी भी महिमाएं तेरी गाए हे प्रभु दिल के मंदिर में है तो सागर के लहरों में कोयल के गानों में जहाँ देखो तू ही तू ये धरती चांद सितारे तेरी स्तुति वंदन गाए नदियाँ और सागर मिलके महिमाएं तेरी गाए ये धरती चांद सितारे तेरी स्तुति वंदन गाए नदियाँ और सागर मिलके महिमाएं तेरी गाए हे प्रभु दिल के मंदिर में है तो सागर के लहरों में कोयल के गानों में जहाँ देखो तू ही तू हे प्रभु दिल के मंदिर में है तो सागर के लहरों में कोयल के गानों में जहाँ देखो तू ही तू जहाँ देखो तू ही तू
Thank you, students. COVID-19 pandemic has created an unprecedented loss and disruption over all across the world. We are in the middle of the COVID-19 which is inflicting two kinds of shocks on countries. One is a health shock, the other one is an economic shock. Words like curfew and lockdown are alien to the rural people, as they were never used to such situations are affected due to shutdown of all modes. Lockdown, stay-at-home orders affect economic, psychosocial, physical risks to the well-being of women and their families. At this backdrop, the Department of Economics organized this virtual national conference on impact of COVID-19 on women in rural India. As a short span of time, we have given the notice, but we are happy to announce that we have more than 110 registrations for this program, and we welcome all the participants of student community, faculties of different organizations, eminent resource persons, other persons to this August gathering or virtual national conference. And also we provided both the links, that is YouTube link as well as the Google Meet link, so that this can be available to or this can be useful to everybody. Now I request our Vice Principal, Dr. Sister Inasiamma, to welcome the gathering. Sister Inasia, over to you.
Yeah, thank you, Josephine. A lovely and warm afternoon to all. On behalf of the management, staff and students of Maristella, it is my great pleasure to extend a very warm welcome to our eminent resource persons for this today webinar. And I am pleased to welcome the faculty and students from other institutions. Women in rural India play a crucial role in agriculture, food security and nutrition, land and natural resource management, and rural enterprises. They have been at the front lines of responding to the pandemic, even as their unpaid care and domestic work increased under lockdowns, mobility is restricted, supply chains are disrupted, and climate and conflict crisis compound COVID-19 impacts. It has strained health systems, widened socio-economic gaps, and shifted, in some cases, strategic and funding priorities, all of which have disproportionately affected women during this pandemic time. In this scenario, to gain a better understanding of the immediate impacts of the pandemic and lockdown, it is gratifying to note that the members of the Department of Economics is organizing this two-day virtual national conference on impact of COVID-19 on women in rural India. I congratulate and thank Dr. Josephine HOD and all the staff and students of Economics Department for organizing this conference. I wish you every success and hope that this conference will deliberate and discuss all the different facets of this important topic and come up with recommendations that will lead to a better, healthier and happier world, especially for women in rural India. Thank you once again.
Thank you, sister. The Department of Economics is very thankful to our resource persons. We have eminent resource persons for these 2 days, and I am proud and happy to introduce you to bring to your notice that Dr. I. Satya Sundaram, sir, retired director of Postgraduate Center, the Hindu College, Machilipatnam. Sir is always ready. Whenever I ask, sir will say, definitely I will come, like that. Sir, so thank you so much for accepting our invitation. And also I am thankful to Dr. Sonal Mobar, Assistant Professor, Center for PG Studies and Distant Education, National Institute of Rural Development, Panchayati, NIRDPR, Hyderabad, who is going to join us at 3 o'clock today. And she will be speaking on gender issues also. Thank you very much, madam, for accepting our invitation. And tomorrow we have 2 more sessions are there. Dr. J. Rani Ratnaprabha, Assistant Professor, Center for the Study of Social Exclusion and Inclusive Policy, School of Social Sciences, University of Hyderabad. Madam also accepted our invitation and she will be joining us tomorrow. And I am very happy and also feeling very pleasure to inform you all that my teacher, my colleague, has also accepted and helped me out in especially searching the resource persons. Our Madam Dr. A. Bhavani, Project Consultant, Center for Entrepreneurship Development and Financial Inclusion, CEDFI, National Institute of Rural Development, Panchayati, NIRDPR, Hyderabad. And Madam said if she is free today, she will join. Otherwise, tomorrow she will be joining in our seminar. Madam is very happy and pleasure. She said that she is always available for any of the program of the Maristella College of Economics Department. Thank you, Madam, for your help and spending a lot of time with us. Now I request our faculty, Mrs. Swapna, will introduce about today's resource technical session one resource person, Dr. I. Satya Sundaram garu. Over to you, Swapna.
Thank you, ma'am. It is my good fortune that I have been entrusted with the job of introducing an eminent resource person, Dr. I. Satya Sundaram garu. Dr. I. Satya Sundaram garu is an economist and a writer. He taught economics to postgraduate students for 40 years. He stood university first in undergraduate level in the subject political science, and he did MA at Andhra University during 1967 and 69. He received PhD from Andhra University in 1982. Dr. Satya Sundaram had the unique distinction of writing and publishing the 10-chapter book Education at the Grassroots in 1968. He served as a director of PG Center, Hindu College, Machilipatnam in 2004. He is an expert in agriculture and rural development and also journalism and mass communications. He attended around 150 national seminars and conferences and 10 international published around 3,000 articles. He was a consultant for a major research project on midday meals, which was sponsored by UGC. He authored several books on rural development and microfinance, growth of agriculture and rural development in India since 1977. He entered in the field of writing and authored various books in the subject economics. Dear sir, we are very fortunate to have you as a resource person to this session. Thank you, ma'am. Thank you, sir. Over
Thank
to you,
you.
ma'am.
Thank you, Mrs. Swapna. Now we will start our technical session one. Now I hand over the one mic to our sir. Sir? Sir? Satyasundaram sir? Satyasundaram sir?
Yes, I am ready.
Yes, sir. You can take over, sir. You can take over.
Thank you, madam. Are you able to hear me?
Yes, sir. Yes, sir. It's
Thank you, madam.
perfectly audible. Yes, sir.
Yes, I am happy to join your webinar
Thank you,
on
sir.
a very important topic, rural women and COVID. Shall I speak for half an hour?
Yes, sir. Yes, sir. Sure. Yes,
I
sir,
will
sure.
provide some background, important background to the theme of your webinar, and then touch on some issues regarding COVID. First, let me say a few words as a background to this one. For a long time, Indian economy was subject to some ideology, and public sector was glorified and the private sector was neglected under the influence of Jawaharlal Nehru and also the Russian experience. But the country has to pay a heavy price for that till the reforms came in. The economy experienced a growth rate of just 3.5% only, not enough to raise the standard of living of the poor. Afterwards, because of these reforms, giving due importance to private sector, the economy picked up growth rate and we are able to achieve a growth rate of 7 to 8% in some years. That was perhaps inevitable in a situation like economic stagnation previously. Now, coming to the theme of our seminar, we are interested in what is happening to rural women. This is a vast field. Women, as such, it is a vast field. We can speak of social status, economic status, educational status, and political status. But as an academist, I will confine myself to economic status of rural women. What is the present status? Measures we can take to improve the status of rural women. And then I will touch on COVID slightly within half an hour. Now, if we look at the economy as such, one major problem with the Indian economy is that the services sector now accounts for 60% of GDP. And the share of the agriculture sector has come down to 14%. And the share of manufacturing sector around 25%. This sectoral imbalance is responsible for our poor performance, whereas China has made rapid progress in all sectors because of a pragmatic policy. We were only guided by ideology, and now we have realized that we have committed a major mistake. There is nothing wrong with the fall in the share of the agriculture sector. All developed countries experience this fall in agriculture sector, but there is what we may call excess growth of the services sector. So in the immediate future, we have to raise the share of the manufacturing sector, which is crucial for improving the productive employment, which can help the rural women on a large scale. The other problem is most of our workforce is in the informal sector. 92% of the workforce is in the informal sector, not guided by it, not subject to laws, regulations, and other things. Within this informal sector, women, they account for 90% of the labor force in the informal sector. This is the real issue. We have to solve this particular problem. This can be solved only by providing more and more opportunities. Income earning productive activities should be made available to the workforce, particularly in rural areas and most particularly for the women. Next, we think of the economic status of rural women. There are a number of studies on rural women. They show that recent studies by ILO and other reputed organizations, they came to the conclusion that if women are given equal opportunities, so far as employment is concerned, along with men, our economy can increase an income rise of $770 billion. $770 billion. More than 18% of the GDP. So from that point of view also, we have to give importance to productive employment of women force, particularly in the unorganized sector. Now, one major problem so far as rural women are concerned is this: there is occupational segregation. That means rural women are confined to less productive, less remunerative jobs only. This has to be changed. Of course, that will change, and there is a diversification of the rural economy when we think of enhancing productive employment in the rural context. But deliberate efforts, concerted efforts are needed to achieve that particular thing. Now look at the very important thing so far as women are concerned. Work participation rate we calculate among rural women aged 15 to 59 in the working force. In 2017-18, we find that only 23.7% of the rural women were employed. Only 23.7%. either in the main occupations or in the subsidiary occupations. So that means the women participation continues to be low, and sometimes economists say that that is because more and more girls are going to schools and they are not going to work. Whatever it may be, this work participation rate has to be raised in the coming years. And the fact is, rural women have very limited employment, productive employment opportunities. In 2018-19, 19.9% of women in rural areas were part of the labor force. That was the situation. Let us look at the payment of wages to women laborers. According to the NSSO, we find that in 2017, men were getting on an average rupees 264 per day. Women were getting rupees 205 in that year. Now, payment of wages, according to a report by Oxfam, March 2019, stated that women get a wage which is 1/3 of the wage of men. That means around 33% less than men. Some work they take up, the gap between the gender gap so far as wages are concerned is increasing. The other problem relates to unpaid work. There has been some discussion when we calculate national income, when we study national income studies, we are not taking into account the unpaid work of women, particularly in rural areas, and therefore economists says that our national income estimates are not properly made, there is underestimation. But anyhow, even now, unpaid work, according to the ILO report 2020, women perform 3/4 of the unpaid work. Men also perform unpaid work to a limited extent. 1/4 of the unpaid work they take up. 3/4 of the unpaid work is being taken up by rural women and also urban women. Now, what are the employment pattern of women? If you look at the employment, where they are working, in what sectors are they economically viable, are they able to provide enough employment? We now understand from this recent statistics that 60% of women are in the self-employed sector. 23% they are working as casual laborers. That means we find most exploitation there. And only 11% of women they are getting regular wages. That means they are employed on a regular basis. That is the situation. So far as I am confined to economic status only. The other problems are, there are so many problems, social status. This is the economic status of the rural women. Let us look at women entrepreneurs. Women entrepreneurs. This class has also emerged as an important class in recent years. For long, women entrepreneurs class was neglected. In recent years, there was some improvement so far as women entrepreneurs are concerned. But the problems are many in this particular sector. We are, for instance, celebrating Women Entrepreneurship Day, November 19 is the Women Entrepreneurship Day. In rural India, I am talking about women entrepreneurs. In rural India, 78% of owned enterprises are managed by men. Here also, there is male domination regarding the enterprises in rural 78%. Only around 22% are managed by women in rural areas. That means low participation. But with regard to total business, if you take not percentage of enterprises, total business, if you take into account, they own only 8%. Women own only 8% of the business. So that means the women entrepreneurs have yet to make a mark in the business field. No, there are also studies on women entrepreneurs. In recent years, some studies said that even micro loans meant for rural women entrepreneurs, they are taken away. They are being devoted to businesses taken up by husbands of these women entrepreneurs. This amount is being used for their businesses. That means the rural entrepreneurs, women entrepreneurs suffer from paucity of finance. The government is now paying special attention to the class of women entrepreneurs. So now we have government had established Bharatiya Mahila Bank. Let us hope that this will improve to some extent the financial problems of women entrepreneurs. And most of these women entrepreneurs, they wish to start their units very near to their homes. That is another development which is undermining the income earning capacity of these women entrepreneurs. Then, what are the measures we can take to improve the economic status of women, rural women? So, raising the level of literacy and education and training them, these three things are very important in the context of helping the women entrepreneurs. The stress should be on educating, enhancing work opportunities of productive and durable nature, not some odd jobs, but they should be productive and durable. The works taken up by, activity taken up by rural women. This requires, so most of us forget how to bring about the change. This requires diversification of the rural economy. It is of no use if you simply educate women, provide them training and empower them. That is not enough. That is very essential, but that is not enough. We have to think of diversification of the rural economy, which alone can provide more and more productive employment to rural women, rural labor force in general, and also particularly rural. What we have to do is we have to learn something from the experience of experience in rural industrialization from China. China has started rural industries in such a way that they have very strong backward and forward linkages. That is why rural industrialization in China did not face major problems, whereas there is only very slow progress of rural industrialization in spite of a long period devoted to that particular issue. In rural areas, in the rural economy, or in rural India as a whole, we have to concentrate on industries which are productive, which are relevant to the resources of the rural areas. For instance, rural tourism sectors which can help the rural women, rural entrepreneurs in a big way includes rural tourism and food processing sector. This in the Indian context, food processing sector has vast employment potential, income raising capacity. These two sectors, for instance, are very, very important in changing the status of rural women and also the rural economy in a remarkable way in a short period. Coming to finance for rural women entrepreneurs, this is a big challenge. But luckily, we have some important help is being given to women because of microfinance. SHG, self-help groups, bank linkage. This involves not merely providing finance to rural women and rural women entrepreneurs, but providing them the relevant training in employment, which can provide job opportunities, and which can also help raise the income levels of the rural women. So repayment under microfinance is not a problem. This is the group approach. You don't find much overuse problem. Now, rural finance was for a long time handicapped by overuse. Under microfinance, that problem has been solved because this is the group approach, and the group leader is responsible for payment of loans taken periodically as and when they get income from the activities they have taken up. This is the correct and pragmatic approach. So that provides some background to you on the present status of rural women, economic status of the rural women. This webinar is also covering COVID. There is nothing wrong if we include this COVID, but the problem here is a lot of literature on COVID has already appeared. For instance, in economic and political weekly, for the last 6 months, you find a number of articles in that journal, in every issue. So that has become a vast topic. But let me say that a few observations on COVID. This COVID it is spreading like wildfire. That is the main problem. And almost all sectors of the economy they were affected by this COVID-19, and some sectors, some sections are most affected, and the migrant laborers. Very unfortunately, the lockdown was declared in time, but no action was taken for to help migrant laborers in time. The government has taken almost 3 to 4 months. They were neglected. Maybe the center thought that the states will rescue them. The states thought that the center will rescue them. Only after 4 months, actual help came, either in the form of food grains available with FCI or other, to a limited extent, job opportunities or payment, financial assistance and all that. Using NRGA, Mahatma Gandhi, National Rural Employment Guarantee Act. These came, of course, only after a long period, say 4 months. That is indeed a tragedy so far as migrant laborers, mostly women, were concerned. Some of them died while traveling to their relative places. The center said that there is no data on the number of deaths. Somebody asked it. That is a tragedy. Then again, we come to the social costs of COVID. Social costs of COVID. There is some studies in the economic and the political weekly. They say that there was a moral lockdown between, for instance, between March 25 and May 31st, 2020, women made 1,477 complaints of domestic violence. Suffered not only economically but also morally because of this COVID-19. There was also latest studies show that sharp rise because of COVID in supply chain and logistics. These costs have increased. They now account for 14% of GDP. That is the direct effect of COVID-19, amounting to $400 million. So this is another economic loss suffered by the economy. With that, Madam, I will conclude my speech. I have provided some background to you.
Sir, if you unmute your camera, audience would like to see your face also. Just in the last 5 minutes, kindly unmute your camera, sir.
Bala, this one, which one I have to press? There are differences. నన్ను చూడాలనుకుంటున్నా. Which one I have to? Okay, tomorrow I will take. Tomorrow. కెమెరా అని కాదు, చూడాలనుకుంటే ఏ దాని ఒకేదని. ఓకే మేడం.
Hello, sir. Sorry, ma'am. Sorry.
Okay.
Sir, you will be finding a icon in a video camera type icon. If you click on that, we all are able to see you, sir.
Icon.
A video camera type icon. A mic icon, a hand raise icon, red mark on. Yeah.
This one?
Yeah, a video camera.
Sir, we have, yeah. Thank you, Oliva. Thank you for helping, sir. Sir, you have two things will be said. Students, sir, మీ కింద రెండు ఉంటాయి. ఒకటి వచ్చేమో లైక్ మైక్ సింబల్ లో ఉంటుంది, ఇంకోటేమో ఒక కెమెరా వీడియో లాగా ఉంటుంది. ఆ వీడియోని మీరు క్లిక్ చేసినట్లయితే మీరు కనిపిస్తారు.
వీడియో లాగా
కింద మీకు ఒక చిన్న స్క్రోల్ బార్
అంటే దీంట్లో ఒక హ్యాండ్ లాగా ఒకటి ఉంది.
దట్ ఈస్ రేజ్ హ్యాండ్. దాని పక్కన లెఫ్ట్ సైడ్ చూడండి సార్, మీకు చిన్న
లెఫ్ట్ సైడ్ టెలిఫోన్ ఉంది, రెడ్ వైట్ ఉంది, ఒకటి వైట్ పక్కన
వీడియో సింబల్ ఉందా?
వీడియో స్పీకర్ లాగా ఏదో సింబల్, వీడియో
ప్లీజ్ దాన్ని ఆన్ చేయండి సార్.
ఈ తెల్లదేని అనుకుంటున్నా నేను.
ట్రై ఇట్ సార్, విల్ సీ.
Allow, I think I have.
Yes, absolutely, sir. Fine, sir. We are able to see you.
Option came.
Yes.
I pressed allow.
Yeah. So thank you, sir. Thank you. I know you are more than, your age is more than 70, but still you are very much interested in enlightening young students and young staff members. I know your contribution.
No problem. This is my subject.
Many of the publications you are contributing in many ways. Just now, I request all the participants, if you have any doubts or any interaction, if you want any clarification from
tomorrow, we can take up, let resource persons speak. Tomorrow we can have some discussion tomorrow at the end.
Yes, sir.
So that this is not disturbed. You ask other resource person to speak.
Madam is already Madam already joined. So then we will move on to the technical session 2.
Okay, ma'am.
Thank you, sir. Thank you so much.
Okay.
Now it's time to move on to the next session, that is technical session 2. Yes. And I welcome, I have seen already Madam joined here. I welcome Dr. Sonal Mobar Roy, Assistant Professor, Center for PG Studies and Distant Education, NIRD Panchayati, Hyderabad. Madam, welcome to Maristella College online. Welcome to the conference.
Thank you, ma'am. Thank you so much for this opportunity.
Thank you, ma'am. And before you start your session, just I would like to request faculty member, Mrs. Shobha, who will introduce you to this gathering, ma'am. Over to you, Shobha. Mrs. Shobha, you can take over. Shobha? Shobha? Mrs. Shobha, you can take over. Shobha? Shobha? Otherwise, you come here and you can present. Shobha, we can't hear you.
A very good afternoon to all of you. It is my good fortune that I have been entrusted with the job of introducing Dr. Sonal Mobar Roy, Assistant Professor, Center for PG Studies and Distance Education, National Institute of Rural Development and Panchayati Raj, Hyderabad. She holds a postgraduate degree in social anthropology and a PhD in sociology. Her curriculum vitae stands as a testimony for her dynamism, creativity, and immense talent. She has 8 years of experience in teaching, research, and training. Ma'am's areas of specialization are sociology of education and health, culture and tribal studies, social exclusion and inclusion related to gender, research methods and methodology, IT in education and health, monitoring and evaluation, social networks, and crowdsourcing. Dr. Sonal is a lifetime member of several national and international organizations. They are like She is a lifetime member of Social Sciences and Health and International Economics Development Research Center, Indian Sociological Society, International Union for the Scientific Study of Population, Circle for Child and Youth Research Corporation in India. Dr. Sonal has a number of publications to her credit. Her publications include 16 papers, including 4 international publications and 2 articles in newspapers and 8 project reports. She attended 4 national conferences and 6 international conferences outside India and 4 international conferences in India. Dr. Sonal conducted 2 workshops and 2 seminars. A total of 14 training programs were conducted by her in NERE Guwahati. Dr. Sonal delivered lectures on situational analysis of women and children with special reference to adolescent girls in India at National Institute of Public Cooperation and Child Development Research Center, Guwahati. She is the recipient of many rewards, and they are Emerging Scholar Award at Imperial College London, UK 2018, Young Scientist Award category at the Indian Association for Social Sciences and Health, 7th Conference on Health, Poverty and Human Development organized by CESSEIP, Faculty of Social Sciences, BHU at Varanasi, India, in the year March 2010. She selected for Dr. Chandrasekharan Award at 31st Annual Conference of IASP, Tirupati in November 2009. She received the Pass Foundation Small Grant Fund in April 2009 to carry out the field work at Ladakh, India. She secured second highest marks in social anthropology in MA in 2009. She received special recognition certificate by DC Lucknow in 2003. Medal for attaining highest marks in anthropology in BA 2003. She was awarded Best Paper Award by UP Government on Land Development in 2004. Ma'am, we are happy to have you. We wholeheartedly welcome you to this webinar. Thank you.
Thank you so much. Thank you so much, Sabha ma'am.
1 minute, ma'am. Satya Sundaram sir, kindly mute your mic, sir, because we are listening to your voice.
Okay. Mute.
Yes, sir. Please,
At right side.
Yes, sir. You can mute that one. Shall I mute otherwise?
Mute. Mute
that mic symbol will be there, sir. చూడండి అక్కడ mic symbol ఉంటుంది, దాన్ని లాగా క్లిక్ చేస్తే మ్యూట్ అయిపోతుంది.
Mic లాగా ఉంది.
Yes, sir. Yeah, that's fine, sir. Thank you. Sonal ma'am, sorry for that. And ma'am, you can continue. Thank you very much for accepting. Now I will hand over the mic to you. You please continue, ma'am. Thanks a lot.
Sure. Thank you so much. Good afternoon to one and all. I'm thankful to Principal Ma'am and Dr. Josephine Ma'am for this opportunity. A very good afternoon to all the faculty members, students and participants who have joined in this virtual national conference on impact of COVID-19 on women in rural India. And I'm really thankful to the organizers for giving me this opportunity. I'll have half an hour, ma'am, half an hour to deliver. Do you want me to share the PPT from my end, ma'am?
Yes, ma'am. Yes, ma'am. You can share, ma'am.
Just a second.
Yes, ma'am.
Ma'am, is the PPT visible?
Yes, ma'am, it's visible, ma'am.
Okay. So I'll start, and then following this presentation, we can have the interaction.
Yes, ma'am. Sure.
So I would also request the students, in case you want to say something, you can put it in the chat box as well. Please reach out to me, and I'll try and cover. I've touched upon certain topics in this presentation today because gender is a very, so to say, umbrella term. So in half an hour, I have touched upon certain related issues, and in these pandemic times, I've tried to look at how people are coping up with this situation, be it their lives, their livelihoods. So I'll start my presentation now. So the title for my presentation is Impact of COVID-19 on Gender. And as you can see, I have purposefully put S in brackets because gender is something that you cannot define it in taking in one category only. So it's actually male, female, transgender, queer, etc. So we actually have a number of categories summing up when we talk about gender. So I'm not going deep into the concept because I have other things to discuss in this presentation, but I just touch upon certain things which are very basic when we are talking about gender. First thing being that everybody knows that when we are talking about the concept of gender, it is a social construct. It is something different from what the biological category of a male or female would be. So it's something that we as a society decide, and it is actually based on person's behavior. So what are the differences in behavior that you would actually try and capture, try and see, try and assess is something related to gender. And since it is different from one person to another, we can say that it's a very dynamic concept. All right. So it's like something that cannot be fixed in certain words or certain definitions. It's something very dynamic, very flexible in nature. What we see nowadays, be it the media, the text that we have, the literature that we have, everyone is talking about gender issues and breaking of the gender stereotypes. Ma'am, am I audible and clear? Let me
yes,
know.
ma'am. It's clear, ma'am. Audible, clear. Everything is fine and fantastic.
Okay.
Please carry on.
Let me know if I'm going too fast. Okay. So because it's all online, I would not know how the audience is reacting.
Yes, ma'am.
All right. So So what everyone is trying to do, the theorists here, the people who are working in the discourse, are trying to make a dent on gender stereotypes. So when we are talking about gender stereotypes, something that is related to is gender roles. So this mindset that boys only wear blue and girls go in for pink, or cooking is only for girls' household chores, boys should be doing all masculine jobs. These are all stereotypes, all roles that are decided by the society. But now a new wave of thinking has come in, wherein people are trying to break these stereotypes. They're trying to cross the borders and see the other side of the whole discourse. So one should also try and attempt to see why these gender stereotypes still exist in certain parts of the country, and especially in rural areas. We see that I'm working in National Institute of Rural Development. Herein, I get many opportunities to actually visit hinterlands, interiors. I have actually, and coming from the domain of anthropology, I've actually visited certain tribal hinterlands, what we in Telangana side called tandas. So I've seen that they have certain fixed norms. This is done by women, this is done by men. And if you try and break those stereotypes, it becomes a taboo. It's something very sinful. So that is how the whole concept, the whole prerogative is made about gender. So one should be understanding when people are talking about gender that it's a very flexible thing. But moving on, I'll be actually touching upon too many things and would like to steer you through this PPT here. And this is the basic when we are talking about gender being a social construct, etc. But then relating it to today's conference, I thought let me just talk about how even in this pandemic situation when everyone is being affected by COVID-19, what all are the effects that COVID-19 has brought, and then I'll jump back to how it has impacted women, especially when we are talking about the impact of COVID-19. So we see that it has actually affected people's emotional and mental well-being. Apart from, definitely, it has made a very drastic impact on physical well-being, because all the symptoms actually lead to deteriorating your immune system. So physical well-being definitely has been reduced, but also be it the person who is affected, even the person who are around him are emotionally and mentally affected, then definitely it has hit people's lives and livelihoods. How do they meet other 2 square meals a day? From where do they get their earnings? So it has definitely affected a large section of the society, especially their livelihoods. And who were they? They were the people who were actually, the migrants. I was listening to the previous speaker here, sir was talking about migrants. So definitely migrants or people associated with the informal sector, people doing very meager jobs, their livelihoods were hurt very badly. And also the pandemic affected people who were doing unpaid care, domestic responsibilities, because their responsibilities actually increased multifolds during this pandemic times when there was a shutdown, there was a lockdown, curfew was imposed, markets were down. So obviously lot of responsibilities came to people who were actually doing the back end jobs. So their responsibilities actually increased in a vast, so to say, pressure. But then who were these people? So as a social scientist, I would call them marginalized people who are actually the most vulnerable section of the society. So if you can see in the slide here, I've kept, when we talk about this vulnerable or the marginalized people, the first thing that hits us is women, then the scheduled caste people, the scheduled tribe people, the differently able people who are having some kind of handicap, the migrants, the elderly. All these people are the people who are quite vulnerable to any kind of risk that the pandemic has brought with it. So the most marginalized daily wage earners, unorganized labor class people, they were the ones who were at the lowest ladder in the social hierarchy. They were the ones who were the most affected. If you pick up any news item, any journal paper, you will see the first line says COVID-19 affected them disproportionately. Now, what does this word mean? It means that there is actually, you can't even calculate to what proportions these people have lost their earnings, their livelihoods, their way of life, their quality of life. So that is how the pandemic has caused a ripple effect, and this cannot be even accounted for. These are certain informal sectors or data points beyond survey methods. So we need to assess them in a very qualitative manner. So if you see the pictures here, these are from my field work. I've put most of the pictures from my ethnographic work. We'll talk about the pictures later, maybe if somebody is interested, but the most of the pictures are from my field work here, just a disclaimer. So I just wanted to give an intro here that according to the World Bank, 12 million people in India slipped down the poverty line during the last 8 to 10 months. And that is a very big number. And this is something that has actually increased. When the study was done 2-3 months back, after that, again, maybe 1 or 2 millions might have added to this number. So these are the marginalized sections who were definitely hit with the pandemic. When we focus on women, as this conference is all about rural women, we see that the disease outbreaks such as flu or pandemics, they affect women and men differently. And there are certain inequalities for women and girls, that there's this kind of discrimination, the marginalization that this sex feels. I mean, this is actually going worse in these pandemic times. Women represent 70% of the health and social sector workforce globally, and special attention should be given to how their work environment may expose them to discrimination, as well as thinking about their sexual and reproductive health and psychosocial needs. So, be it the Asha Didi, I hope some of you might be aware when we have these Anganwadis and primary health centers in rural India, we have the Asha and the A&M Didis. So, when we are putting them right in front to deal with this pandemic situation, we should also look at how we can prevent them from catching the disease. So there we find a lot of discrimination. See if there are any preventive medicines or some PPE kits coming in. Women are the last ones to receive such privileges. It's the men who would actually, get their chance to take all these preventive things and prevent themselves, because the society thinks that male are the more important part of the society. They're the bread earners. They are the ones who actually run the show. So it's always, if you read that book by Simone de Beauvoir, it says the second sex. We are always the second sex. We cannot become the first sex, as in we cannot take the first step in the social hierarchy. It's always the men who are on the top, and the women are always ranked second in the social hierarchy. So that is how the whole concept drives the whole societal thinking. So when we come to impact of COVID-19 over the whole countries, we see 200 countries were affected, badly affected, and faced the impact by this COVID virus. And not only in the spread, I would say the speed with which the virus spread, the scale at which the virus spread, the scope, the re-emergence, and non-termination. If you look at the newspaper today, since yesterday it's in the news that they've cancelled CESS, what kind of this mutated virus could do, what kind of damage it could do. So when we compare to previous such historical things, such as Spanish flu in 1918, we see around 20% of the world population got affected then. But now when we see these percentages with the current pandemic, it is actually in multifolds. And even in a country like India, around 70% or 77% of cases in 20 districts out of 733 districts in India have actually faced the pandemic very, very severely. So this is just the data file here. I just thought I'll put in some latest data for your reference. But then coming back to what I was talking about, how the marginalized have actually, been impacted by COVID-19. The first question, if you take a step back, when we talk about women as a working class, in quote unquote, my question here is, do we actually acknowledge this women as a working class? Because if you see most of the data produced by government agencies, they only acknowledge male workforce, and the female workforce is actually blindly just shoved away. They don't even acknowledge the workforce brought in by the women section or women part of the society. So the report COVID-19 and Gender Equality, Countering the Regressive Effects, brought in by McKinsey Global Institute, estimates that women make up almost 2/5 of the global labor force, but have suffered more than half of total job losses. So you can see it was actually the females who actually bore the brunt of pandemic rather than the men. So why did this take place? Why are the women always the sufferer? Why are they the ones who are the victims of this kind of pandemic? So why did this take place? Why are the women always the sufferer? Pandemic impact than men. Women had faced 1.8 times more than that. So when we are talking about all these ratios, it should make us actually quite disturbed and quite restless. Or why when we are talking about gender equality, we are talking about people having equal human rights, why then all over the world the women are facing this trouble? Why are the women being marginalized? Why are they being devoid of their rights? So these are certain questions that one should be thinking about. So earlier this year also, I just put it here for reference, the UN Secretary, he predicted COVID-19 could reverse the limited progress that has been made on gender equality and women's rights. So what was he trying to prophesize? And his words have actually, they have come out as a prediction rather than just simple statement by the UN Secretary General. It actually was like a prophecy that he had made, that forget about women's rights. What are you talking about? Gender equality. Pandemic mein pura chhu ho gaya gender or women rights. So it's not even possible for talking about gender equality right now. That is what the UN Secretary General made a statement all about. So when we see why are we talking about women in this pandemic? What role do they play? So we over the period we've seen in studies that women entrepreneurs are relatively more vulnerable in this situation, because what are the domains that they are engaged in? They are engaged with the food domain, the arts, the recreation, and retail. And when these kind of health or some pandemic occurs, health risk or pandemic occurs, women are the first ones to be hit hard. They form the informal sector, which doesn't have any SOP. There are no standard operating procedures. So what do? They are just left to fend for themselves. So as the COVID-19 pandemic continues to ravage economies, especially the lives and livelihoods of these marginalized people, it is already apparent that there is a greater negative impact on women and the progress towards gender parity. So it is high time that we scholars, we academicians try and think of how to mainstream the women issues, the women rights in the whole discourse when we are talking about gender. So this is the time when we have to reflect of how to formalize the informal sectors, how to mainstream them, and especially when we are talking about tribals, the rural women, the marginalized women, the old, the destitute women who are just left by their families. How do we make some social security nets for them? Can the government really bring in some policy decisions to make their future secure? So the governments do promise certain programs and schemes, but are they being implemented at grassroots level? So this is the time that all the scholars need to question the whole discourse of gender and also the interventions that have been planned. So when we are talking about gender parity, if you look at my previous slide, I talk about the lives and livelihoods getting impacted, and how the progress toward gender parity has also gone way back. It had never, I would say, it will be very critical of me to say that we had progressed, but whatever baby steps also we had taken, we have actually reverted back. So what exactly is gender parity here? Maybe somebody can share what they observe from this picture. I would know that people are listening. Maybe somebody can unmute and share what they observe from this picture here.
Same plate only, ma'am.
Same plate, yes, ma'am. So when we are talking about his plate and her plate, we should see that they are the same. Whatever the plate, the food item is served, in the equal amounts, the plate should be served to the women as well. That is when you start at the grassroots level. When you have this concept clear in your mind that whatever is being served to a male is also supposedly being served to a female, that is when we actually understand this whole gender framework, right? So thank you for that observation. So because of the paucity of time, I'm actually moving from one concept to another. So yes, you understood what is gender, you understood what are marginalized and how the COVID is affecting the marginalized. Then we saw what exactly do we mean by gender parity, wherein we are talking about the whole debate, wherein this unequal rights are there and people are building upon these norms in the society, and it is from one generation to another unless these stereotypes get broken. So one agent of change that has actually emerged during this time, I'm working with rural development. So this is something that we appreciate and the government has also taken cognizance of. Something that has come up as a shining star is self-help groups, the SHG groups. So what is it about? It's all about women coming together, forming a group, conducting monthly meetings, taking account of all the contribution they have, and actually sharing monthly revolving funds. And this money can be used for various purposes, sometimes for a marriage occasion, paying the fee of the child, for some medical treatment, etc. So in this way, the women in India have actually, in all the states, in all the districts, in all the villages, these self-help groups have started emerging, mushrooming all over the country, and have emerged as agents of change. And their focus is on local entrepreneurship. So once you go to a rural area, you will find that actually it's the women who have actually emerged as local entrepreneurs. They have actually started, having bank accounts. The backward bank linkage is taking place. They are now much more aware about their rights, about how to make decisions at home, and actually taking control of their lives. So these self-help groups have actually led to empowering women. Though I'm not very fond of using the word empowerment, but then again, just for reference sake, this has actually helped women to overcome their challenges. So definitely, when we're talking about gender, you cannot ignore the role of the self-help groups that have emerged as powerhouses. So I thought in today's presentation, I'll touch upon the self-help groups. Now, this is something just 2 weeks back. If you can see, these are screenshots from my laptop. You can see two women groups. One is a blue group and one is actually it's orangish color. So these are two self-help groups because they want to show solidarity. So certain SHG groups also have their uniforms. So once they meet, they wear the same color sari or the same sari if they have, so that they show that we are coming from one group, that kind of feeling, solidarity. So just 2 weeks back in these COVID times, you can, if you zoom, you see they're also putting masks, etc. They were maintaining proper SOPs of COVID. So they conducted these group meetings because see, life goes on. You cannot just shut down everything and sit at home. So SHG, and they need money. See, economic activity goes on every day. Eatings, buying vegetables, buying milk, etc. goes on, right? So they need money for this. So they conducted meetings, and we were watching and monitoring this from NIRD. So these are two group meetings taking place in rural areas in Madhya Pradesh. So if you see the standing group, they were actually singing their group song just to get that zeal, that kind of group ethos together. And in the other blue one, you can see they have the cash book, the register, and then they are counting money. So these SHG meetings have also continued despite this COVID times. Now, this is what we talk about gender empowerment. This is what we talk about, breaking stereotypes, coming out of the marginalization. So these SHG women are actively participating despite the COVID pandemic. Now, this is something that was quite appreciable. So I thought I'll share with the audience today. So when we're talking about dynamics, the gender dynamics, we are very much aware about the, inequalities, the social norms, the unequal power relations that exist in the society. But to understand these, we need to have sex disaggregated data. That is the fundamental need. We need to go down and look at the problem from a micro level. We have to collect data and understand these vulnerabilities if we want to talk about women's rights, if we want to talk about what all atrocities women are facing. So it's quite necessary that in these times, if you were to conduct and gather some data, it has to be based on comparison of male and female and what benefits the either of the categories benefiting from. So this is not just about rectifying long-standing inequalities, but we want a fair society that is much more, beneficial for both the categories, be it male or female, a resilient world. We want people to feel safe and equal and respectable and having the same dignity. So what we women feel, if once the food is late, you will never see women first putting food in their plate. First they will serve to the elder in the family, the husband, the kids. Probably it's towards the last only when the women would take whatever is left. That is the general practice, right? And we say it is ingrained in our DNA. That is what a woman is all about. But then again, one has to look at it from a very different lens, a different perspective, and try and see in this garb, nothing unfortunate or unjustified is taking place with you. So we need to understand these gender dynamics that I've been just talking about. So when we are talking about this inequality, in these COVID times, I thought let me also touch upon safety of women. I don't know how many of you were following these news items that came in. Even in COVID wards, there were incidents of sexual assault with women. There was some case in Kerala where in the ambulance the girl was being taken and there was a sexual assault. So when we are talking about, even in COVID times, one should not neglect the safety of women. So even in the response to COVID-19 in March, the WHO issued a guidance which included advice to prioritize services related to reproductive health and make efforts to avert maternal and child mortality and morbidity. Because WHO understood if the lockdown takes place, if all the medical supplies are shut down, if there are no doctors, the most affected would be ladies who are actually pregnant or lactating mothers, would be mothers. So one should take care that they are put on priority list. But again, okay, WHO ने बोल दिया, उन्होंने बोला कि हाँ, we should take care. But what is happening at the ground level? Are our COVID wards safe? Are our women safe when they are put in isolation? So who's taking the responsibility of their safety? So we need to think about all these issues. See, it doesn't matter that only my livelihood is affected, only my food is affected, my health is affected. My safety is also an issue. As a woman, I should feel safe when I am coming out of my house. So in these pandemic times, our safety also got affected. Safety of women got affected. So this is all also needs to be taken cognizance of. Then this was one demerit side. I thought let me talk about a positive side also. In this pandemic times, just like the SHG thing, we also saw that people, especially the women, they got together because their husbands had lost, they were daily wage laborers or someone, so they had lost their livelihoods and there were mouths to feed, the families were there. So what women did, they actually started their social entrepreneurship, small scale, micro level entrepreneurship projects emerged, startups emerged. So we saw that women, started making face masks, or they started making disposable pattal and dona, plates and bowls. So in my next slide, I'll show you and we'll talk about that. So that actually shows that in various parts of the country, if you can see, it's a very dense slide here. So if I'm not sure if my cursor can be seen. Okay. So if you see here, I'll start from here. This is something called Pattachitra. These paintings tell a story. Now, in this COVID times, this whole section of the society, especially the women, rural tribal women who were into making these pattachitras got affected because they lost all the market demand. They lost all the supply chain. So what they started doing was they started some NGOs and some, these new startups, they engaged them and started selling online through Amazon, through Flipkart, connecting them through online market. And they also, what they did, they started making figurines and paintings with current pandemic depictions. So people putting face mask, etc. So they started linking the current situation in their paintings. Then you see the center picture. This is what I was talking about. People started making bamboo stuff, something that requires low investment and gets you a good price. So they started diversifying products. They started making different objects. You can see disposable plate and bowls being made. So this also, so if you see state-wise, this picture is from West Bengal. This is from Assam and northeast states, other states. Then this is from Maharashtra. So there is a tradition there, Lavani. So Marathi folk songs, and they go about his performing. This is a theater kind of a group. Now in COVID times, because of all the shutdown and no people to come and see your show, they started putting live this through Facebook Live, and they started performing and reaching out to their audience through online modes. Then if you see this picture, here the Asha Didi and NM Didi also got back to their jobs. See, how long can you just sit ki COVID ho jayega? So they didn't want to sit at home. So we see that women started coming in front. They became the frontline warriors. So they reached out to the people to tell them to, how to wash their hands, keep a sanitizing liquid around, how to maintain social distance, wearing a mask, etc. Then this picture is from, again, Guwahati, Assam, wherein you see people, these women started, using their stitching skills by making indigenous, this folk mask, face mask. This picture is from Chhattisgarh and Bihar, wherein the Madhubani painting is quite popular. So we saw people coming in and painting those, very intricate designs on the face mask and selling it. So they started, and this new trend of, okay, we have to wear a face mask. Why to wear those surgical masks? We will wear our ethnic mask. So this kind of trend, this kind of zeal towards life was shown by people in these COVID-19 times. If you see this last picture here again, NIRD also gives a lot of trainings to rural women, tribal women. So they were trained how to procure raw material and make sanitizers at a very low cost. So this kind of social entrepreneurship came up to deal with these COVID pandemic times. We saw from all pockets in the country how women played a very important role when it came to fighting with COVID-19. So herein, I would be coming to the end of my presentation. I have put some farmer pictures, ladies, farmers, they are doing some various works in the field, collecting firewood. So I want to say here is that, see, problems do come. Everyone is facing a very big challenge concerned with their lives and livelihoods. But again, it's how you fight this pandemic, how we want the policymakers to reduce the gender gap, provide a safe social and just society for the women, and yes, being resilient towards it. So this is how I briefly sum up my presentation here. Thank you. I hope I've not exceeded much time.
Not at all, ma'am. Not at all.
So I thought I'll just touch upon certain issues, and that would bring in a lot of discussion with the students here. I've not gone deep into many concepts. I've touched down upon them and actually highlighted the various coping mechanisms, how all over the country women have come forward to fight with COVID-19. So yes, thank you. Thank you so much.
Thank you, ma'am. Thank you for enlightening us on different issues, especially gender dynamism and also in social entrepreneurship, how women in rural areas really they take it as a challenge and they themselves came with the true as like trendsetters with the ethnic masks and all those things. It's really very nice. I thank you for this one. Now I will open this session for the interaction. Now I request all the participants, you can interact with Madam Sonal, Madam, because Madam is so busy. Tomorrow maybe Madam is not able to connect with us if she has some other work is there. So I want the participants, you can ask your doubts, or you want any clarification, or you want any explanation. If you want anything, please
feel free. You can unmute your video, reach out to me. I've kept it in a very light form. I've not gone too much into the discourse discussion. If you in case you feel like, you can please go ahead and ask me a question.
Miss Oliva?
Yeah, ma'am.
I think you can start.
Ma'am, good afternoon, ma'am.
Good afternoon, Oliva.
Ma'am, I'm from the Department of Journalism. I have a doubt regarding this. See, as you said, the performing art men from Maharashtra, they have started the live through Facebook. In the same way, for example, from the teaching community, many manpower was cutting down in the industry, right?
Right.
So
A lot of people were laid off. Yes,
ma'am. So everybody started their own means of income through media, ma'am. Like how you said, like Amazon, e-card, YouTube channels, blog writing. So how this things has given them opportunity, ma'am. Even the pandemic also taught them many things like media. and
Right,
opportunity.
right. So Oliva, good question there. I don't know if I'll hit the nail, but then see, who had thought that people would be giving all their exams, trimester exams, through online mode? Our professors who are maybe 60, 70 years old, who had never operated a laptop as such, started using Google Meet and WebEx, and they find it challenging. They do not know where the icon is, mute hai, nahi hai. So see, people have started adapting. Now this is called adaptation. You are using IT, information technology, to the best use. You are trying to make the best of it to try to connect people. How else will the programs, academic programs run? Or how will, these tribal groups or these performing artists, they have only this skill. Now, if you don't even give them an opportunity to perform that skill, from where will they, manage their monthly budget? So what happens is, once they are connected to FB Live, depending on the number ratio of views, they are paid some money. So that is how they started earning. So yes, at the other side, we saw a lot of people losing their jobs, being laid off from corporates as well. Big companies like IT companies also started laying off. Extra resources were cut off. But then we should always look at the brighter side and see how people started coping up, adapting to the latest things, and also making the best of these users. So that is how I would look at it. The perspective should be positive here. I hope I answered, Oliver. Or you
Yes,
wanted to
ma'am.
know
Thank you.
something else? Uh-huh.
Do any of the government institutions taking initiative to provide technical training
Yes,
to women?
yes. NIRD continues to provide training. All these months, our trainings did not stop, Oliva. We tried to reach out to as many people. We also started, you see, physically, we would have some budget constraints because of the hostel rooms or something. So we would say, in a batch, we will only entertain 30 women. But now, since everything is online, we started having numbers up to 80. So we tried to reach out to n number of people through mobile. They would connect to us, listen, and then follow the instructions. So it's been, like, I would say, it has actually led to other way around, trying to reach people and training them during these lockdown times. So it has been very beneficial.
Ma'am, hello, ma'am.
Yes, ma'am. Yeah.
It's not a clarification, but I would like to ask you. Ours is a women's college where we have entrepreneurship cell is there, and also we have incubation center, both
Okay.
science part of view, social entrepreneurship part of view. I am the coordinator of the incubator center. Just I would like to ask you, can we get any help from NIRD for our institution, especially to improve? Already we have center is there. We wanted to improve more and more in that one. Is it possible to have any ma'am, regarding that?
I think we can collaborate, ma'am. There's nothing that stops us from collaboration. So this needs to be taken up with the proposal kind of thing with the administration. Definitely, if there are any trainings or we have, if you have your academic calendar, I am posted in a center. We deal with the PG diploma programs. But apart from us, there are 23 centers who only provide trainings. So definitely, and for social entrepreneurship, there's a different center itself. So if we connect through that center, definitely, collaboration is possible. So it's something that can be done. Definitely.
Thank you, ma'am. Thank you so much. Thank you.
I look forward to that actually. So that would be nice. I would definitely take it up.
Yes, ma'am. Definitely. Thank you, ma'am. Thank you. Students, if you have any more doubts?
Maybe some of you can unmute and show me your faces. Let me see.
Oliva, I think, Oliva, you can show your face now. Oliva, actually, she worked in Maristella up to last year. Now she is doing her PhD in Nagarjuna University.
Oh, nice. Okay, because it's always nice to see my audience who are there. I'm conducting online classes. I make the students unmute their video.
I request all the participants kindly unmute your video, please, just for a second.
Let me also see who is listening to me.
Yes, Vali. Hi. And our faculty members, Aparna and Shobha, are all there. Okay. And Satya Sundaram sir already the first resource person in the technical session. Another member is Dr. Nagasundari, Director MBA and also in charge of the Entrepreneurship Cell, Maristella College.
Okay, nice. Good afternoon to everyone.
Good afternoon, ma'am.
Good afternoon, ma'am.
Yes, nice to connect to all of you. So
Thank
thank
you, ma'am.
you.
It's pleasure, ma'am.
In case there are any questions, I would be happy to take any more questions.
Yes. Yes.
Okay, probably there are some presentations due after
Yes,
this.
yes, 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 ma'am. Yes, ma'am.
I
Yes, ma'am.
think,
Now we
ma'am.
will. Yeah, please will carry on. Thank you very much, ma'am. You have enlightened us on all the topics, and thank you very much for accepting our invitation. Just with a short period of time, within 2 days, I contacted you, and you were busy. I was unable to contact you, but our appointment was fixed in only in the message in online mode only. It was online virtual conference. It was anyway. Thank you so much, ma'am.
Thank
Thanks
you
a lot.
so much. Thank you, ma'am. Good day.
Thank you. And now we have paper presentations. Now I request Miss Srividya from third BA Social Work. You can take over and present your paper, ma'am. After Srividya, we will have Rishta is there. Rishta, be ready. Then Shaini Kejia, you also be ready. Then later you continue. Srividya, you can take over now.
Yes, ma'am.
Yeah.
Ma'am, is my presentation visible?
Yes, ma'am. Yes, ma'am. Srividya. Yes. Your
So,
PPT is visible and your mic is also audible, very much audible. You carry on.
okay. So, good afternoon, everyone. I'm Srividya Vishnubhatti. I'm pursuing my bachelor's in social work from Maristella College. And the topic that I have chosen today to present is on impact of COVID-19 on women. So, let's try to understand some stats. COVID-19 surely exacerbated in a lot of ways many of the inequalities that have long existed under the surface. And when we come to the topic of economic disparity, two things that surely come to our mind is the gender pay gap and the wealth gap. Coming to the pay gap, for women and men for doing the same job, women are paid 8 to while a man is paid $1. And coming to the wealth gap, a woman is a holder of around 32 cents to a man's dollar. So during the COVID-19 pandemic, facts say that this gap is widened. For many people, it is quite bad when compared to the 82 cents that I've mentioned in the current example. In countries like Africa and all, it is quite bad. This is the general statistics. If we observe, this is the bar graph showing the participation of women in the labor force. When coming to China, it is around 60.5%, while in India, it is only 60.5%. And the women workforce layoffs, women employees and entrepreneurs continue to suffer the impact of layoffs and business losses to a greater extent than men. And as per the recent analysis that is conducted by McKinsey Global Institute, women are more vulnerable to COVID-19 compared to men. And coming to the layoffs, female job loss rates owing to COVID-19 are about 1.8 times higher than that of the male job loss rate. Women in formal and informal sectors. Women entrepreneurs are relatively more vulnerable in this situation as they tend to operate mostly in sectors such as food, arts, recreation, and retail, which are the worst affected by the pandemic. As the COVID-19 pandemic continues to ravage the economies, lives, and livelihoods, it is already apparent that there is a greater negative impact on women and the progress towards gender parity. And coming to the women in the informal sectors, we need to think about women like who are involved in the cleaning staff in the marriage halls, the ayas at over 1,000 play schools, and the housekeeping staff. When thinking about them, all those jobs they're dominated by women, and most of these jobs are lost. Coming to the positive and negative impact of COVID-19, firstly, I would like to start saying that we have seen COVID-19 as a negative impact on the economy mostly. But coming to the positive part, COVID-19 has not derailed the economy completely. There are domains which have sectors which have been beaten due to COVID-19, but there are also companies which have done better. They have generated around 100,000 jobs. For example, Amazon. During the pandemic, it has generated around 100,000 jobs, which is over a million. So there are companies which have done great pertaining to their domain. It always depends on the domain and the area in which you are involved. Coming to the job losses or the revenue losses, many companies have shut down, and many companies they have increased their revenue. And I have people in my own family. My topic is working women. So I started interacting with them, and I got to interact with them. I have asked them what are the positive and negative aspects that you have seen. So when I interacted with them, the first thing that came to their mind is the commute hassles. They said the COVID-19 pandemic have surely helped them to do more productively the work, because work from home they can directly log into the work. It is not that they have to travel longer distances, and the commute it generally drains out the person. In metropolitan cities, if you observe, people need to travel around hours and hours. They start at 6 o'clock or 7 o'clock and they reach the office by 9 o'clock. By that time, the 3 hours of travel, it just drains them out. So the commute, they are free from the commute hassles because of work from home. And they said, being a woman, she was available at the time when she was most required. So that was the most helpful part. And coming to the negative, the workload. Many of the women they have not, gained the experience, or they are not able to balance the work-life balance. Like they also stated that it is like in the pandemic they're feeling like they're working around 24/7 because they're not able to balance their work. There are cases. I have my own sister. She works at the US client, so she works 4:30 to 9:30. No certain time limits. In some cases, they are working 24/7 because they're not able to adjust the time gaps and monotonous routine. This is something everybody has faced. It is like a single day is getting repeated over and over. You're doing the same work. There is nothing, if you're not sketching out what you need to do, something productive, it's like you're repeating the same day again and again. And the future aspect, bleak of future aspect. Some women they left their job before the pandemic, and with the quarantine, they couldn't search for new jobs. And most of them feel like they're so unproductive, and they're getting stressed because they have not a single penny left. And during this quarantine, they have spent all the savings, and there are people who don't have money to pay their children's fees and to meet the day-to-day expenses because they're jobless. And coming to the could not be possible if the quarantine was not there. They used to work 24/7. They go to the office in the morning, come back night. They're all tired, so they don't get enough time to spend time with their family. And flexible working hours. Women feel that the companies have provided the flexible working hours. Anytime they can log in as it's work from home. So they feel it more flexible when compared to going to the office. But sometimes do feel that the personal touch is lost. There are cases in which you should be personally present at the place rather than virtually being present. For example, when a new employee joined the office, when people join during the pandemic time, they're not comfortable when compared to people who have joined in offline mode because they got to know the people, they got to know the workspace in person. They get to collaborate with the seniors and for the case in the quarantine. And vocational learning, many women they have indulged themselves. They have started brushing their skills and all the interests that have, they've stopped due to their heavy workload, like maybe painting, cooking, whatever it is. So they started indulging themselves into more vocational learning, many productive aspects, learning new technologies. And like our research person has stated, this pandemic has surely helped us, improve our technology base because we are not familiar with Google Meet, WebEx, anything before. Due to this quarantine, we got to know all these things. We got to accustom ourselves to these things and have focus on health. Which woman doesn't want to be fit? But due to these work stress and not having a proper work balance, they don't tend to on them. So this quarantine has surely provided them with a lot of time to focus on their health and staying fit. So these are some of the positive aspects and negative aspects. I would like to conclude, hoping that I have provided some information. Thank you so much.
Yeah. Thank you, Srividya. Thank you for the presentation. And now I invite Rishita from 3rd BSc to present her paper. Ms. Rishita, you can take over.
Yes, ma'am. Thank you so much.
Yeah.
Ma'am, am I audible?
Yes, ma'am. Audible and visible also. Your
Yes.
PPT is visible and you are audible. You can carry on. Yes.
Yes, ma'am. So, first of all, a very good afternoon to all the respected excellencies present in this particular virtual meeting. So, it's really an honor to be a part of this. So, the topic for today that I'm going to focus is impact of COVID on rural women. So, women have always been a major and an important part, whatever it is, whether it is good or bad, women are always there who are important. Even in this COVID-19 situation, women are the most affected personalities, I must say. So basically, 2020 is a year which we had a lot of missions and visions. So we thought major tasks. But unfortunately, all of this is not possible because of this pandemic. But still, we all hope that this dark cloud shall too pass. So coming to the topic, whenever we talk about this women and impact of COVID on women, we mainly neglect this particular section, that is the rural women, the ones which are not so, the ones where the literacy rate is very, very low. So when we talk about the women participation in India's workforce, according to Times of India, you can actually see the recent analysis. This is 2015 to 16 marked in yellow and 2012 to 13 marked in orange kind of thing. So if you can see that compared to urban women, rural women are actually contributing more. If you can actually look at this particular scenario, you can see in the year 2015 to 16, 31.7% of the rural women have actually taken part in working for India. So it is something which is really appreciating and definitely surprising too, because when compared to urban women, rural women are a step ahead. So before getting into the actual topic, I would like to actually focus on what are the problems that are faced by the rural women and what are the steps that can be taken so that they can be empowered and their situation can be uplifted. So the first basic thing that I think that has affected a lot because of this COVID-19 is unemployment. As we all know, most of the rural women are into agriculture. So they are the ones who are into a lot of physical activity. So as per the research paper, which is published by Ashwini Deshpande, who is a professor of economics at Ashoka University, she claims that women who are employed before lockdown were 23.5 percentage points less likely to be employed compared to men in the post-lockdown phase, because already the lockdown has completed and most of them who have lost jobs are trying to get into new jobs, opportunities. But unfortunately, women are less eligible or women are less likely to get employed. If you can actually see the graphs, the bars which are actually showing the employment of women when compared to that of men, you can see the employability opportunities were comparatively very high for men when compared to that of women. While you can see the last column shows the fall in employment where it is just 29 for men and it's 39.5 for women. So you can actually see that the employment in March 2019 to 20 refers to the average employment in the 13th month period of March 2019 to 2020. So women are always prone or women are always there at the low line or at the bottom line. So they are most affected. So unemployment is the main thing that is actually digging them up because these people are very poor. So there are families where women is the head. There is no male person to take care of the entire family. So women have to lead the entire family, take care of the education and definitely the health facilities. But because of this unemployment, they are unable to earn. They are unable to
feed their children. So there are a lot of consequences. Now, moving on to the next point, it's the unpaid work, which is a very serious concern. In India, women spend an average of 351.9 minutes a day on unpaid work as compared to average of 51.8 minutes per day by men. So a lot of unpaid work has been seen, especially in the care of healthcare, especially in the department of this healthcare. A lot of them are into different works categorized into different branches or whatever, where women are working without money. Because of this, they are unable to earn. So furthermore, women's unpaid work burden can be even higher in low-income households who have more dependents, where demands for care tend to be greater. As I've already said, if the woman is the head of the family, then she has to definitely take care of everything. She is responsible for the entire house. She is the only breadwinner. So there are so many depending on her, let it be her children, parents, or if there are some old people, then all. So she is the only person who is actually taking care of everyone. And even though she is employed or even though she is working, we know that the amount she is earning on a daily basis is very, very low when compared to that of urban women. The third fact or the third point that I'd like to focus is they have increased care responsibilities. We know that COVID-19 situation has really brought major impacts on the society, and especially talking about women, most of the responsibilities have actually increased. Usually women perform a lot of activities, even if it's not in COVID, but this COVID-19 situation has worsened the case even more, because when it's normal, then children used to go home and maybe people used to go out for work. But now, since it's lockdown and all of them are restricted to stay at home, children are at home. So parents, that is the women who have women who are the breadwinners of the family, have to take care of them, take care of the children. And there are migrants, like people who are working in different villages to earn money or food. If they are sick or if there are some responsibilities, then this complete thing is onto this one particular lady, that is the woman who is the breadwinner of the family. So she has to feed the family and she is the only source of income. So a lot of responsibilities have actually increased. So apart from the daily work she does, she has to also balance all the things, maybe at home, maybe at the workplace, or whatever may concern. So the next thing is talking about the youth or the young girls. Most of them are out of schools. We already know that when compared to that of the urban girls or urban women or urban education system, it is we know that it is very less developed, that in villages very few girls were sent to schools for education. We know that rural, if you can look at this particular thing which is actually provided, I've actually taken this from the main survey that is taken by the very prominent survey center. So it is actually the rural primary school age children. If you can look at the education thing, like more than 2 times are likely to be out of school when compared to the urban counterparts. Usually the number itself is low, but now it is increased, that more than twice are actually out of schools because of this COVID situation. And only 23% of poor rural girls complete their primary education in sub-Saharan Africa. That is the case. And most of the girls were out of schools just because they were very, very vulnerable. They can't afford to buy a mobile or a digital tablet or laptop to attend online classes. So digital classrooms are really, really challenging. And even in the cases of very developed countries like USA, Sweden, it's really, really vulnerable. But when it comes to India, which has quite less development when compared to US and Sweden, so it's a lot of facilities are not available, where rural girls are actually not able to get into this. So most of them dropped out. And the final thing that I would like to focus is women are the major victims of domestic violence. Now, if you can actually look at this particular graph, which has been displayed here. So if you can see, this is rural women, urban men, and rural men. So it is rural women who have been actually the major victims of domestic violence. We need not take this COVID-19 situation into consideration. Even if it's not the pandemic, it is almost the same, because violence against women is a general case or a general scenario that we are talking about from ages. till today. So violence against women, it is maybe physical, emotional, psychological, or sexual. So the number of complaints have actually increased, especially in this lockdown period. So the number of complaints increased since June, recording a peak in July of 2,914 cases, as economic distress and job losses could have led to more domestic violence. So domestic violence is something that is really prevailing, especially in this past 6 to 7 months in this lockdown period. Now, what are the ways that we can ensure gender-sensitive policies in the wake of COVID-19? We have seen what are the challenges or what are the difficulties that have been faced by this rural women. Now, I would like to actually discuss or throw some light on what are the ways to ensure that this gender-sensitive policies in the wake of this COVID-19 situation. So first thing is we can ensure women's access to information and participation in data collection. So basically now, because of this pandemic situation, the governments and organizations should disseminate information in formats that are accessible and understandable to rural women. So most of the rural women are uneducated. The literacy rate is very low. So whenever they try to pass on some or the other information, it would be better if these rural women can actually understand. Maybe it can be picturized, or it can be sent via messages or in their native languages. Now, the next point I would like to say is governments using digital platforms to disseminate information should consider distributing mobiles to women. Now, it is very important because especially in this COVID-19 situation, we have realized that using technology is a must. So maybe distributing mobiles to women, especially the rural women, may also empower them. So they also come to know what is technology, what is this complete digitalization and all. So I would like to talk about this women groups, which are actually very prominent. That is the self-help groups. So a group of women form together, a small group, maybe a group of 10 to 12. So there are special cases in this Kerala and Bihar. Most of them have come together, especially in this lockdown, and they have sit and they made lamps for Diwali, and they made a lot of sanitizers, masks, and what all they can do. They sat and they had created opportunities for themselves, which is self-employment. So that is how we can actually do. And the next thing is ensure female farmers access to markets and agriculture resources. Now, what has happened is because of this lockdown, most of us are actually preferring this online marketing, online business, or online whatever it is. We are booking or we are just ordering everything online. So this farmers or the agriculturists who are actually in the rural villages have no access to these markets or agriculture resources. So in this scenario, when the markets are closed, the governments can establish online markets. They can link up some small scale producers to consumers. Governments can also purchase surplus produce at their fair price and transport them to towns and cities. So even if there are no particular prices for that particular product, then the government itself can give a minimum price for that particular commodity or product or that particular vegetable, and then they can buy that thing from that rural women. Next is the governments and international donors can also support local women's savings, loans, associations, and cooperatives to provide similar financial services. Now, governments can come forward, they can give loans, subsidies, and lot of things where women can actually save and also use that particular money for investing more in their agriculture or investing more in whatever business they have. And they can also purchase seeds, fertilizers, etc., whatever is necessary for their crop. And almost the last point is adopt a measure to prevent domestic violence. This particular topic or this particular issue has been focused from years, but still it is prevailing that government should establish appropriate safety nets and fund women's organizations that provide protection against domestic violence. So government should designate shelters as essential services, establish free helpline centers and other safe reporting mechanisms and outreach centers, and provide health and other supporting services so that women are at the safe place. Urban women are in touch with the technology. They know most of them can protect themselves. They're at the safe side when compared to that of the urban rural women. So rural women must be educated, and some or the other guidelines should be given, maybe from the government or maybe from the voluntary organization, so that they can also empower themselves and know what is happening all around. So thank you for giving me this wonderful opportunity, and definitely I think I've actually provided something. So thank you for giving me this wonderful opportunity.
Thank you, Rishita. Now it's already 4 o'clock. We came to the end of today's first day session. We have a few more paper presentations, and that will be continued in the tomorrow's session. So, as a convener of the conference, just I would like to give a brief outline about today's program. We have 2 sessions, technical session. The first session was taken over by Professor I. Satya Sundaram Garu, and he mentioned about the status of women in India, and also he mentioned about the impact of COVID on the rural women. And the second session was taken over by Sonal Roy, and she concentrated on the gender dynamism and social entrepreneurship, and how the women are taking the challenge, and how the opportunities are transformed into different trends, and they become the trend setters. And also we have two paper presentation from student point of view. One was Miss Vidya from 3rd BA Social Work, and she mentioned about the workforce, women in workforce, especially in the scenario of the COVID-19. And the second paper is presented by J. Rishita, and she mentioned about impact of COVID on women, especially unemployment, domestic violence, education, and also she mentioned about how it is affecting the women in overall situations of data and everything. Thank you very much, all of you. And now I will hand over to Miss Swapna to present vote of thanks.
Thank you, ma'am. On behalf of management, staff, IQAC cell, it is my pleasure to propose vote of thanks. We express our deep sense of gratitude to our beloved principal, Dr. Sister Jessica Quadras, who always support us in institutional values and best practices. Our special thanks to our Vice Principal, Dr. Sister Inasia and Ms. K. Anuhya, for their guidance in conducting the virtual conference. We sincerely thank Dr. Girija Nambiyar Ma'am, Dean of Planning and Communications, and Dr. C.H. Krishnaveni Ma'am, Coordinator, IQAC, without whose support this virtual conference could not be a successful one. We thank the resource persons, Dr. I. Satya Sundaram Garu, Sonal, Mobar, Roy Ma'am, for accepting our invitation and to be a part of this webinar. We wholeheartedly thank Ms. Roja Ma'am, Head Department of Computer Science, and IT team, Mr. Prasad and Rajnikant Sir, for their technical support. Our sincere thanks to the faculty from all the other colleges for their active participation. At last, the students, thank you one and all. Thank you, ma'am.
Thank you, Ms. Swapna. And tomorrow we'll continue with the technical session 3 and 4 from 2 o'clock onwards. And I request all of you join in day 2 on tomorrow, exactly at the same link which was provided to you. And for now, thank you very much, and have a good evening, everybody.